Ko Craig Johnson Taco Ngoa no Ingereri Au. Ke mano atu ke Aotearoa Taku Kanga. Ke tafaro ora Aue mahi ana. Ko mano atu te awa, ko ruahini te monga, ko rangatane te mana whenua. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Thanks for inviting me to give today's presentation. What I'm hoping to do over the course of this is to talk about how we think about animals generally in an ethical sense. And in doing that, there will be a historical aspect to what I'm talking about, because we've had a relationship with animals as a species since we were a species, and that relationship has changed over time, and the ways in which we think about it has changed and continue to change. So the things that I will be talking about today are: what is ethics? What is welfare? And how can we decide what to do when doing the right thing is important? For what is ethics, I really want to talk about the three major ethical theories that people use to consider animal welfare issues. And I find it's much easier to talk about them if you talk about them in their metaphysical basis, in the way in which the people who developed those theories thought about the world when they were developing those theories, so in a semi-historical aspect. Then we'll talk about what is welfare, just in terms of the three orientations of welfare and how the importance of sentience applies when we're making decisions about the animals that are our patients. And thirdly, I'll talk about some concepts that we can use to think about through an issue that we're dealing with and to try and decide how we can do the right thing in that particular circumstance. On to ethical theories then, and the first and obvious question: what is ethics? So, ethics are the moral principles that govern a person's behaviour or the conduct of an activity, or the branch of knowledge that deals with moral principles. And increasingly, moral philosophers are talking about ethics and morality as synonyms for each other. They are the ways in which we govern our activities in order to be able to know and hopefully to do the right thing in a given situation. There are many ethical theories, and the three that I want to highlight today are the theory of teleology, deontology, and utilitarianism. And the reason for dealing with those are that they are the three main theories in classical Western ethical thought that provide different platforms for us to make decisions. It's also interesting that they emphasize different roles of, or different ways in which we make decisions. And so looking at those three theories can give us an excuse to look at the different ways in which we make decisions and the different reasons that we provide for a decision that we've made. In order to understand teleology, then, we need to understand a little bit about Plato's metaphysics, the way in which the ancient Greeks thought about the world that they lived in. And a summary of ancient Greek thought is really that things are defined by their purpose. So, using a very common example of how to talk about defining things by their purpose, we could ask the question, what is a chair? And we could define a chair in a teleological sense by saying a chair is a thing whose purpose is to be sat on. And then we can provide various different examples of chairs which are more or less comfortable to sit on, which are designed to be sat on, whose purpose is to be sat on, and which we could sit on in different circumstances as we go through. I'm sitting on a chair that's very similar, although not as flash as the chair in the top left of this image. But were I sitting on a beach, I'd be far more likely to be sitting on a chair like the one in the top right. But the purpose of all of these things is to be sat on. Of course, it's possible to sit on things that are not chairs, but in the case of Humpty Dumpty sitting on the wall, although Humpty was sitting on the wall's primary purpose, its telos, was not something to be sat on. Something that the Greeks considered when they looked at all these chairs was that all these chairs were different. Some of them were more useful than others, more comfortable, better in different circumstances, but none of them were a perfect chair. And yet, when we have a concept of a chair in our minds, we have a concept of a single entity, a single thing that is a chair. And so the Greeks decided that all of these chairs that we see in this image, and every other chair that we could think of, was actually an imperfect reflection of the thing that was a perfect chair. And they decided that this perfect chair, although it didn't exist in our universe, existed in a perfect universe that they called the world of the forms. And so this is Greek metaphysics. The imperfect things in our universe are reflections of a perfect exemplar of those things that exists in the world of the forms. In summary then, things are defined by their purpose. A chair is defined by how well it measures up to the perfect chair in the world of the forms, and the telos of the chair is to be sat on. Its purpose is to be sat on. This is an extrinsic telos because it's not something that is of value to the chair to be sat on, it's a usefulness to people. And the Greeks said that when something had a telos that was useful to something else, usually humanity, then that was an extrinsic telos. But some things had an intrinsic telos. And here is an example of an intrinsic telos. On the left is an acorn. The Greeks would say that the telos of an acorn is to become an oak tree. And that telos has nothing to do with usefulness to humanity or anything to do with people. It is the destiny of that acorn to become an oak tree. And so that is an intrinsic telos. Getting back to ethics then, and thinking about what is the right thing to do in a given situation, the Greeks would use a teleological argument to say that in the world of the forms, there exists a perfect person. And when we're considering what is the right thing to do in any given situation, what we should do is to try and be as similar to that perfect person as we can be. And so to do what that perfect person in the world of the forms would be, and so better reflect our teleology or our purposefulness. And so what we're effectively saying here is that the intention of an activity is where we should look for its ethic. If we intend to do good, then what we're doing is ethical or moral. And that's a teleological theory of ethics. The purpose of ethics is to become a good man. A good man is the man that's reflected in the world of the forms, and that's what we should try to be like. Okay, to move forward to the next theory, we're going to do 1,000 years of history in well less than a minute. It's a bit of a summary. So about 400 years after Plato and Aristotle, a prophet was crucified in an obscure corner of the Roman Empire. And the prophet's followers took the Greek metaphysical thought of the world of the forms and combined it in an interesting way with a local religious sect that was prevalent in the area and came up with a new religion that eventually became called Christianity. The world of the forms became heaven, and it became the place where God lives. This Christianity became the predominant religion in the Western culture, and all of Europe used this religion and developed its culture to a point where it had a feudal society. The feudal society was based on the strength of individual bands of people, and particularly the strength of the leaders of those bands. And small bands in society, or tribes, developed, which gradually amalgamated into bigger and bigger societies. And straightforward feudalism, the strength of the person that came to be called the king, no longer seemed to be an adequate way to control these much bigger societal forms. And so laws were developed. And laws are a set of rules for doing the right thing. They are deontological. So deontology is where the morality of an action should be based on whether that action is in itself right or wrong under a series of rules. It moves away from teleology, and it says it doesn't matter if your intention was to do the right thing. What matters is whether you conformed to a series of rules or laws when you were doing what you did. And what you did is not measured by your intention, but measured by your conformation to those rules. Deontology is a lot easier to explain to our mindset than teleology. So let's move on another few centuries and go through the Enlightenment. This is a picture of an experiment showing that a bird requires air by putting it into a vacuum pump and pumping out the air, but it's worthwhile looking at it in more detail. It was painted by Joseph Wright in 1768, which is at the height of the Enlightenment, the height of a process by which thinking changed to accommodate scientific thought. And so the world was no longer thought to be a pale reflection of heaven or the world of the forms, but it was beginning to be understood to be a place where a set of rules existed, and that by demonstrating those rules, we could find out how the world worked and live within it. What's really interesting in this picture, I find, is that the scientist at the centre of the picture looks very similar to the God in heaven in my previous slides. And that's really quite interesting because to some extent, the scientific thought of the Enlightenment replaced the religious thought of the period before the Enlightenment and changed the way that we thought about the universe that we live in. About this time, the theories of consequentialism, the major one being utilitarianism, were developed. And using Bentham's definition of utility, utilitarianism is based on the idea that utility is a property in any object whereby it tends to produce benefit, advantage, pleasure, good, happiness, or the converse, to prevent the happening of mischief, pain, evil, unhappiness to the party whose interest is considered. What does that mean? Well, it means an action is right if it leads to good outcomes. And so now we've got three ethical theories in a nutshell. Well, an acorn. Teleology, an action is right if its intended purpose is good. Deontology, an action is right if it obeys the rules. And utilitarianism, an action is right if it leads to good outcomes. And these three theories encompass not all of, but a lot of our current ethical thought. What's interesting is that each of these theories has things that lend us to think it's a good theory, and also each of these theories have problems with them. Teleology, an action is right if its intended purpose is good. It's great to think that you intend to do the right thing and that's the right thing to do, and to live in a world where what you hope to achieve is a measure of how good you are in setting out to achieve it. Deontology is easy. Here are the rules. Follow the rules. It's not difficult. Utilitarianism has a lot to commend it because it seeks to make the world a better place. To do the right thing is to do something which leads to an outcome that makes the world a better place. But there are problems with each of these theories. Teleology, my intentions were good. The road to hell is paved with good intentions. It doesn't necessarily lead to a good outcome if you approach doing something with good intentions. And so when we measure things teleologically and we look at the intentions, we're not really looking at the outcome or the kind of things that we want to get out of the process. Deontology is great if the rules are good, but the rules are general and they don't always fit the circumstances that we find ourselves in. And so often, although we have rules, we feel that we're called to move outside of those rules because the rules don't quite seem appropriate. The main problem with utilitarianism is that we can't predict the future. If we define a good action as an action that has a good outcome, how can we know the outcome when we do the action? And so how can we do anything that's good because we don't always know what the outcomes are? And so although these theories are useful in different circumstances, none of them is universal and not all of them have problems and issues that make them not really good candidates as general ethical theories. In fact, there is no really good candidate at the moment for a general ethical theory, a single theory which tells us the right thing to do in all circumstances. Okay, enough of ethics. I want to move on to welfare and talk about the three orientations of welfare and what they mean and how they relate to the animals that we deal with. So the first thing to say is that animals, or at least the animals that we routinely deal with as veterinarians, are sentient. And in New Zealand, it's really easy for me to say that because it says in my Animal Welfare Act that animals are sentient, and so there's no argument. But generally speaking, the mammals and the birds and the reptiles and many of the fish and a few invertebrates are generally held to be sentient animals around the world. And we can define that sentience in different ways if we look at the three different ethical theories that I covered in the first part of my presentation. So we can say animals are sentient because they have intrinsic telos. They have a purpose which is part of the animal and is not related to humanity, and therefore they are sentient. We can say that animals are sentient and therefore they need to be the beneficiaries of rules, a deontological thing. If we have something that can be benefiting from a set of rules, then we can say that that thing is sentient. It has an awareness of the rules, or at least an awareness of its benefit from them. And in a utilitarian sense, we can say that animals are sentient. They are parties whose interest needs to be considered. So when we're thinking about welfare, we're thinking about how we deal with sentient beings who are not human in ways that support their telos, allow them to benefit from the rules, allow them to be considered as a party of interest. And we generally have three orientations of welfare. We have a health orientation, we have a naturalness orientation, and we have an effective state orientation. And I want to deal with each of these in turn. I'm going to deal with effective states first because most people that work in animal welfare science feel that the effective state is the most important part of welfare. And so we need to make sure that we understand what an effective state is before we deal with health and naturalness, which sometimes are important in welfare, but sometimes are not that relevant to welfare. The effective state then is the experience that we get from an underlying emotional state. So it's not the emotional state itself, but it's the feeling we get, our understanding of the emotional state. And it's really important because in order to have an effective state, one must be sentient. One must be able to perceive and feel and have a feeling of ourselves. Often when philosophers are asked what that means to be sentient or to have an effective state, they say that it's what it is when it feels like something, or what it is to feel like something. So, for example, going back to a chair, we can't imagine that it feels like anything to be a chair. It's just a few pieces of wood, maybe a bit of foam, maybe a little bit of cushioning or material, but it doesn't actually own any feelings or perceive anything. It just is a chair. When we say, what is it like to be a dog? Then that's completely different. And we might feel that it's like something to be a dog. I certainly can feel what it might be like to be my dog, who I think has a ridiculously good life, gets fed regularly and spends most of his time lying in front of the fire, especially when it's the middle of winter, as it is at the moment in New Zealand. But if you can feel something, if it is like something to be you, then you are sentient and you have an affective state. So let's look at those affective states, and the best way to look at that is to just put up some pictures that typify different affective states. And so here are a series of affective states. They illustrate emotions, but the affective state is not the emotion itself. The affective state is what it's like to perceive that emotion. And when we talk about affective states, we talk about them having positive or negative valence, i.e., are they a good affective state, like delight in the top left corner, like curiosity in the middle? Are they a bad affective state, like boredom in the bottom left corner or fear in the bottom middle? Affective states can be good things and they can be bad things. And within that valence, they have an intensity which speaks to how profoundly or deeply the affective state is felt. And so we would say, for example, that both boredom and fear have a negative valence, but fear is a much more intense affective state than boredom. And so when we are looking at the welfare of an animal, we are looking at the valence of its affective states positive and the intensity of those positive affective states compared to the valence of its affective states negative and the intensity of those negative affective states. That's the affective state concept of welfare. Naturalness is often a little bit misguided in my view. It really speaks to the ability of animals to express their natural behaviours rather than to live in an environment that necessarily looks natural. And so if, for example, we are considering a dairy cow, we are not really thinking about how natural its environment is, but we're thinking about the extent to which it can express its natural behaviours within the environment that it finds itself. And if we look at this video clip, we can see that although this scratching device is not a natural thing for the cow in the picture, the cow is having a rare old time, having a really good scratch, and is expressing some natural behaviour in having that scratch. And the scratching and the scratching device is undoubtedly contributing to the positive affective state, to the positive affective state of the cow. And so, even though this is not natural, it is an example of naturalness through the natural behaviours that the cow is exhibiting. It's important to remember that when we're looking at naturalness, we need to be looking at something that is important to the animal. And so if you see a cow scratching itself on a tree in the middle of a green field, that looks natural to our eyes, but it may well be that the greenness of the field and the blueness of the sky are not really important to the cow, and actually it's the feel of the bark of the tree that's the important part. And in replicating this in an unnatural or farmed environment, we are allowing the animal to perceive the naturalness of its behavioural environment, even though it doesn't look particularly natural to our eyes. When we look at the orientation of health, again, we need to be careful because we need to think about how the affective state plays a part in that. And in talking about that, I want to talk about John, who was a friend of mine who died about 6 months ago of lung cancer. Now, there was a time, about 2 years before he died, when John was healthy, and that was great. But then a series of things happened which resulted in him dying of lung cancer, and I want to look at those things and talk about whether or not he was healthy when those things happened and whether or not they contributed to his affective state. So the first thing that happened was that John developed a cough, and he went to the doctor and was treated with a course of antibiotics and some diagnostics, and the cough went away. And although John wasn't actually healthy at that point because that was the first sign of his impending lung cancer, he thought he was healthy, and so his affective state was not influenced by his actual ill health. The cough was treated and went away, but subsequently to that, John was diagnosed with terminal lung cancer. He was no more healthy on the day before he was diagnosed than he was unhealthy on the day after he was diagnosed. His health was about the same, but his knowledge about his health led to quite a profound difference in his affective state for some time. His cancer was treated, his symptoms were managed, and eventually he died of lung cancer. But if you think about his understanding of his health throughout that period, and especially if you imagine that John was not a human but a dog and so was unable to think about the future implications of the information that he was receiving, then you can see that for periods during this progression, although he wasn't healthy, his affective state was not changed by his lack of health. And so when we're thinking about health and its contribution to welfare, we need to think about the affective state. And so something that is just a little bit unhealthy, like, for example, a sprained joint or a minor injury, can actually affect the welfare or the affective state of an animal much more than something which is much more profoundly unhealthy but is not yet apparent to the animal. And so we need to think about the welfare in terms of affective state and how health influences that, rather than thinking that health directly affects welfare. Okay, we've talked a little bit about ethical theories. We've talked a little bit about what welfare is. And now, before I hand over to Polly to talk about the practical nuts and bolts of how we decide on the way we treat animals, I just want to put up some ideas about principles that we can use or concepts that we can use when we're trying to find out how to do the right thing. And I want to talk about 5 different concepts. I want to talk about autonomy, avoidance of harm, benefit, special relationships, and justice. Autonomy is the extent to which I'm allowing others to freely decide to participate in something in the light of their own beliefs and values. So the question as a clinician with a client is, am I allowing the client a degree of autonomy in making decisions about what happens to their animal in the light of their own beliefs and values, rather than shoehorning them into my beliefs and values and trying to put pressure on them to behave in the way that I would like them to behave. Avoidance of harm. To what extent will doing or allowing something to happen risk, cause, or fail to alleviate harm? So when we do a particular treatment or not do a particular treatment, what is the risk that our course of action will fail to alleviate the potential harm that we see? And going back to health and affective states, you could say we have diagnosed some lack of health in an animal or some illness. To what extent is dealing with that illness or not dealing with that illness or dealing with that illness in a particular way risking the animal's affective state to be harmed in the future because of its impending perception of that illness or its current perception of that illness. Benefit is the other side of the avoidance of harm coin. To what extent will doing or allowing something create, support, or make likely benefits to accrue? To what extent am I likely to be able to benefit this animal, and particularly this animal's welfare, by the actions that I am proposing? As clinicians with clients, we always have a special relationship with our clients. That's what being in a profession is all about. That's why we have a profession, because we understand that as professionals, we are entering into relationships with our clients, which are not normal everyday relationships. And so we need to ask ourselves, to what extent will doing or allowing something to happen honour the ethical norms generated by the special relationships that I have with my client? And when we're looking into that, in all of our veterinary professions around the world, we have codes of ethical conduct for our profession, and those codes of ethical conduct outline the ethical norms that are generated by the special relationships that we have with our clients. And so we have to ask ourselves the special question, not just am I alleviating harm, am I causing benefit, but to what extent am I acting within the ethical norms of my profession when I do this thing? And the final principle that I want to allude to is the principle of justice. And generally speaking, in ethics, justice has a particular definition, and it means the extent to which the benefits and burdens of my actions will be fairly distributed. So, if I am acting upon a patient and that patient will benefit from my actions, the chances are that I'm acting with justice. If I am acting on a patient and the patient's owner or my career or my financial situation or a whole host of other things are likely to benefit from that, then I have to be very careful to think about whether or not I'm acting justly, because there is a chance that the benefits and burdens of what I'm doing will not be fairly distributed. And so whenever we think about how we behave as veterinarians towards our animals, we need to think about the ethical norms and the different ethical approaches that we might take to those animals and to what we're about to do. We need to think about how we will affect the animal's welfare, and particularly about the health implications of affecting the animal's welfare. And we need to think about the way in which we're behaving towards that animal and whether it conforms to ethical norms, particularly the ethical norms of our profession, but also to the principles of autonomy, avoidance of harm, creation of benefit, and justice. Nō reira. Tēnā koutou, tēnā koutou, tēnā koutou, katoa.